All right, today we're going to journey deep inside the human body. We're talking about the incredible technology that lets doctors create super detailed maps of our most vital highways, our arteries.
So let me ask you this. How would you map a highway system that was completely invisible? I mean, it sounds kind of impossible, right? But that is the exact challenge that doctors face every single day.
You see, our arteries are basically the superhighways for our blood. They're delivering oxygen and all the good stuff everywhere it needs to go. The problem is, they're hidden deep beneath our skin, our tissues, our bones, making it incredibly hard to spot a problem like a blockage just from the outside.
So, how do you see the unseeable? Well, medicine's answer is this powerful technique that, for all intents and purposes, gives doctors X-ray vision, but with a really clever twist.
It's called arteriography. And even with all the newer fancy technologies like CT and MR scans, arteriography is still the gold standard. It is the ultimate, indispensable tool for getting the clearest possible picture of the vascular system. It's the definitive roadmap. Now, to pull this off, you need a little more than just a standard X-ray machine. You need a whole specialized toolkit. We're talking hardware, software, and some special substances to make it all work. First up, the imaging unit itself. Doctors have two main options. They can use a massive fixed-mount unit that lives in a specialized suite. This thing has incredible power and resolution. Or they can use a more flexible, portable C-arm unit. And there's a clear trade-off, right? The portable one is cheaper and can be wheeled from room to room, but that fixed unit, it gives you a much bigger field of view and the raw power you need for really detailed images, especially in larger patients.
Okay, now for the secret ingredient, your arteries and your blood. They just don't show up on a normal X-ray. They're basically invisible. So to make them pop, doctors inject a special substance called a contrast agent. This stuff temporarily makes the blood much denser to X-rays, so it shows up bright and clear.
And this brings us to a really careful choice doctors have to make. The most common agent is iodine-based, and it gives you these absolutely crystal clear, high-quality images. But there's a catch. It can be risky for patients who have kidney problems. In those cases, doctors have another option. They can use carbon dioxide gas. Now, the image quality isn't quite as sharp, but the CO2 just dissolves harmlessly into the bloodstream, which is way, way safer for the kidneys.
So you've got the hardware, you've got the contrast agent, but the real magic, the real genius, happens in the software. It uses some incredibly clever processing to turn what would be a blurry X-ray into a precise, detailed map of your arteries. The process is called digital subtraction angiography, or DSA. It's so cool. First, the machine takes a quick X-ray before any of that contrast dye is injected. This is called the mask image, and it just shows all the bone and tissue. Then, as the contrast agent flows into the arteries, the machine takes a series of live images. And here's the brilliant part. The computer digitally subtracts that first mask image from the live ones. It basically erases everything that isn't a contrast-filled artery. And what you're left with is just a perfect, isolated picture of the blood vessels. It's amazing.
It's a brilliant system, but it does have one critical weakness. For that subtraction trick to work perfectly, the background, the bones and tissues, can't move at all between the first shot and the live shot. So what happens when the patient does something totally normal, like take a breath? Well, the image gets messed up with what's called motion artifact. But of course, technology has an elegant solution. It's called pixel shifting. The software lets the operator literally nudge the original mask image, pixel by pixel, until it perfectly realigns with the patient's new position. That little shift completely erases the motion artifact and saves the image. It's so clever. Okay, so we've solved for motion, but there's another challenge. Remember, arteriography gives you a 2D image of a 3D structure. So, is looking at it from just one angle, say straight on, really enough to make an accurate diagnosis? Oh, absolutely not, and this is why. Imagine a blockage that's flat, kind of like a pancake. From the front, it might be almost invisible. You'd barely see it. But if you turn that X-ray machine and get a view from the side, that same minor issue can be revealed as a severe stenosis, which is a really dangerous narrowing of the artery. And that's exactly why doctors almost never rely on a single image. They take pictures from multiple angles to get the whole story.
Now, this technology is obviously powerful, but like any medical procedure, it comes with risks. The most common one is actually related to those contrast agents we talked about. So let's look at how medical teams make sure patients are kept safe.
The biggest concern here is something called contrast-induced nephropathy. It's a form of kidney injury. The risk is definitely highest for patients who already have kidney problems, but other things like being dehydrated, advanced age, congestive heart failure, and even diabetes can make a patient more vulnerable.
But the good news is, doctors have a very clear playbook for protecting these patients. The number one most effective tool is actually simple: IV titration. They also carefully manage medications, like pausing drugs such as metformin. And as we saw, for those high-risk patients, they can choose safer agents like CO2. And crucially, they always use the absolute minimum amount of contrast they need to get a clear picture.
Arteriography has been the gold standard for decades, but it's not standing still. The future isn't about replacing it. It's about integrating it with other incredibly powerful technologies.
The next frontier is something called 3D fusion CT. Now get this. This tech takes a patient's super detailed CT scan from before the procedure and digitally overlays it onto the live X-ray image during the procedure. It creates this highly accurate 3D roadmap. It's like a GPS for surgeons, letting them navigate complex anatomy with incredible precision. And it does all this while cutting down on procedure times, radiation exposure, and the amount of contrast they need to use.
So, from simple X-rays to real-time 3D fusion, our ability to map these hidden highways in the body has just grown exponentially. And as this tech lets surgeons navigate with pinpoint accuracy, it really makes you wonder what conditions that we once thought were inoperable might soon become routine procedures.